This patient is a 31-year-old male with persistent problems related to patellofemoral malalignment and maltracking. And here you can see the significant damage he's done to his patella secondary to the maltracking. First, we went ahead and debrided a little bit with the shaver mechanically. And the next thing we'll do here is introduce a suction punch to remove some of that articular cartilage that has been undermined. We'll continue to debride this area with the shaver. And you can see here how far lateral his patella is in relation to his femur and his trochlear groove. And we switch the shaver now to the lateral portal to continue to debride things. We're looking now with the arthroscope through the medial portal. And now what we'll introduce here is a thermal probe. This is a TAC-C by Oratec. And we're going to try to stabilize the margins of this articular cartilage by sort of heating it and shrinking it, trying to get the layers to sort of meld together rather than more becoming organized rather than disorganized by sort of superheating them and kind of melting them together. We try not to get too aggressive with this. Again, this is not really proven technology, but we've had fairly good success with treating some of these articular cartilage disorders with this thermal probe. But again, there's no studies to prove this yet. This is really an experimental type thing. So we'll continue along the margins of the patella with this thermochondroplasty and sort of seal things off here. You can see the huge defect he had in his patella from years of really maltracking. And this is his lateral retinaculum. And pretty soon here you're going to see another probe, another thermal probe. This is a ligament chisel by Oratec, and it's a fairly small ligament chisel. This is actually off the handset. This is the micro ligament chisel, and what we're doing here is layer by layer we're doing a lateral release here, releasing the lateral retinaculum. And using this small instrument, you really go through these layers of tissue layer by layer, and it's fairly useful because you can really identify the vessels that cause a big hemarthrosis post-operatively. So again, we'll just continue down the lateral retinaculum layer by layer. And you'll see some of these vessels come into view here. And you can actually cauterize these vessels using this probe quite nicely. Right there as an example, which is responsible, again, for a lot of the postoperative bleeding and a lot of the patient discomfort that you see with this type of procedure. This is not the quickest way to do this procedure, but certainly I think it does help with the bleeding postoperatively. You also get a great look at the anatomy. So the idea behind doing the lateral release is tight lateral structures, pulling the patella more laterally and not allowing it to engage the trochlear groove at the appropriate amount of flexion of the knee. And so what we're trying to do is release that check rein and allow the patella to track more normally and eliminate some of those abnormal forces on the articular cartilage. Here we're getting about to the last layer of tissue until we're into sub-Q fat here. Nice thing about this is it's so controlled. And there I think we have a complete lateral release. We'll go ahead and later on take a shaver and debride some of that. And now what we're doing is a medial imbrication arthroscopically, and we're using sutures from outside in. These are number 2 Ethibond sutures, and we're working from outside the skin back into the back intra-articularly and passing these sutures sequentially to imbricate the medial retinaculum and VMO muscle to sort of pull the patella more medially, and try again to correct the malalignment and maltracking this patient has. There's the second suture. We pass a total of 4 with this patient. And what we'll go ahead and do after those sutures are passed is make an incision on the skin, identify the sutures underneath the skin, and then go ahead and tie them and pull things over more medially. And you can see that effect as we sort of pull on these stitches.